So magnetic resonance imaging, or MRI, is routinely used in clinical practice to produce detailed images of the inside of your body. Now, an MRI scanner produces images by using magnetic fields and radio waves. We will be using MRI within ReIMAGINE to look at the prostate and specifically to see if we can use it as a screening tool to identify patients at potential risk of prostate cancer. This is very similar to having a mammogram for breast cancer for women. If you are enrolled into the ReIMAGINE study and you undergo an MRI scan, you will need to go to University College London Hospital. When you arrive in the hospital, you will have to wear a gown, removing anything metal from yourselves so you can go into the magnetic field area within the scanner room. Within the scanner room there is a flat table. You'll be asked to lie on the flat table. The flat table will rise and we will position your prostate in the center of that machine. The scanner will be controlled during the scan by a radiographer. The radiographer is sitting outside of the scanner room using a computer to control the scanner. The radiographer is able to see inside the scan room at all times through a glass window, but also through a camera which is able to watch you to make sure that everything is fine. The radiographer is also able to communicate with you via an intercom, and you're able to communicate with the radiographer through that intercom as well. The scan itself should take about 20 minutes. Now, when the scanning starts, you'll hear a thumping noise whilst the images are being acquired. That thumping noise is electric currents which are going around the coils of wire within the MRI scanner, and as they switch on and off, that's what's causing the noise to be made, and it's a very normal thing. The scan will take 20 minutes. During that time, it's really important to keep very, very still. Any sort of movement during that time when the images are being acquired can cause the images to become distorted, which means it becomes very difficult to interpret the information on them, and we may not be able to use them to make any sort of interpretation at all. During the 20-minute time, some people find it very relaxing and are able to relax and go to sleep. You will be given headphones during this time as well, and those headphones will make those thumping noises quieter, but they can also be used to play music and help you to relax. Some participants may find that being confined inside a cylinder is a little distressing. If that is the case and you wish to come out, you can alert the radiographer either by speaking, because they can monitor you via the intercom, or by a little squeezy ball that you have, which will set off an alarm for the radiographer and allow the radiographer to bring you out. The scan is going to be composed of 3 types of images. The first 2 types are the images that we use in routine clinical practice, and they look at the anatomy of the gland, of the prostate, and they look at the microstructure, so the detailed structure of the prostate. We're also going to be acquiring a 3rd type of image. Now, this is a very new technique with the 3rd type of image, and we think it might work better than the first 2 techniques combined. As a radiologist, I will be looking at the anatomical and the microstructural images, and I'll be producing a report from the scan that you have. And the report will either be positive or it will be negative. If it's negative, it essentially means that there is nothing that we can see on the scan of any concern. If it is positive, it means that there's something there that will require you to have a full MRI scan, as you would if you were coming in for a standard scan in a hospital for your prostate. The reporting process should take 30 days to complete. This report will then go back to your GP, and your GP, if required, can request any further tests to look at your prostate in further detail.
The MRI scan was fine. I had headphones on, very relaxing, fell asleep, no problem at all.